Yo, good morning. So many changes happen during pregnancy. Yeah, the person gets pregnancy. So I'm gonna talk about cardiac changes in pregnancy. Yeah, cardiac changes in pregnancy. I'll start with the physiological changes in pregnancy during antepartum. I'll also talk about postpartum changes and also intrapartum changes. By the way, antepartum just means during the period of pregnancy, then intrapartum, that's during labor, then postpartum, that is after labor, possibly. Yeah. Then there is also a period from postpartum up to 6 weeks. Then the uterus, every physiological changes, the uterus comes back to normal. Those physiological changes now back to normal after pregnancy. That is now after 6 weeks postpartum. It's known as postpartum. Yeah. So, what happens during pregnancy when a woman gets pregnancy? Yeah. So one, the blood volume will increase by 50%. Then secondly, the vascular resistance reduces by 20%. Yeah. Not only that, even the heart rate will increase by 10 to 15%. Then also the cardiac output will increase by 30 to 50%. Not forgetting the BP. The BP will reduce, especially in the second trimester of pregnancy. And the funny thing is that blood pressure, blood becomes hypercoagulable in a pregnant state, becomes hypercoagulable. So the blood will be prone to formation of some clots. Yeah. So the woman becomes more at risk of that. Yeah. Then during intrapartum, or also I'll talk about the combination between intrapartum and postpartum. So the cardiac output will increase in active labor. When there is active labor, the cardiac output increases. Just imagine it has already increased during pregnancy by 30 to 50%. Now, again, during labor, it also increases. So it puts the patient at risk. So these pregnant women, they are prone to develop heart failure during that intrapartum state. So with each contraction, we'll talk about the myometrium. Yeah, so it contracts. So with each contraction, 300 to 500 500 mils blood from the uterus goes into circulation. Then, and do not place a pregnant woman in a supine position. Of course, that is to avoid supine hypotension. Yeah. So the BP will increase with contraction. So as the more contraction, the more elevation the BP becomes. Also, these changes of intrapartum and antepartum physiological changes of pregnancy can persist to 1 to 2 weeks postpartum. Yeah. All right. Thank you. This has been Jay. See you next time.